Have you ever watched your little one, full of wonder and curiosity, exploring every inch of their tiny body? They might be babbling, wiggling their toes, or perhaps reaching up and tugging at an ear. It can be a surprising sight, and naturally, it often sparks a question in a parent's mind. So, to answer directly, yes, ear pulling can absolutely be a normal and very common behavior for babies and toddlers. It is not always a sign of a problem, and often, it is just part of their everyday growth and exploration. Now, why do babies pull their ears? Their little world is full of new sensations, and their body is one of their first exciting discoveries. Sometimes, ear pulling is simply a way for them to explore their own anatomy. They are learning what their hands can do and what their body feels like. Think of it as a form of self-soothing, similar to thumb sucking. Another common reason is teething. The pressure and discomfort from new teeth coming in can sometimes be felt in the ears because of shared nerve pathways. Babies might also pull their ears when they are feeling sleepy or overtired as a way to wind down. Or it could just be pure curiosity. They are fascinated by textures and sounds, and their ears are a part of that sensory adventure. While ear pulling is frequently harmless, it is wise to be observant. If your baby is pulling their ear and seems otherwise happy and content, chances are it is nothing to worry about. However, if you notice ear pulling accompanied by other symptoms, then it is a good idea to pay closer attention. Look for a fever, increased fussiness, difficulty sleeping, rubbing or pulling at the ear constantly, reduced appetite, or any discharge coming from the ear. These are the red flags that might suggest an ear infection or another issue. If you observe these additional signs, it is always best to contact your pediatrician for advice. An interesting point to remember is that young babies, especially those under 6 months, have a more horizontal eustachian tube compared to older children and adults. This anatomical difference can sometimes make them more prone to fluid buildup, but it does not necessarily mean every ear pull indicates an infection. It just highlights why their ears are a frequent area of focus as they develop. Understanding the many reasons behind ear pulling can bring a lot of peace of mind. By knowing when it is just a baby exploring their world, and when to look for additional clues that might point to a potential issue, you can feel confident in how you respond. Most often, it is just another adorable quirk of your growing little one, but being informed helps you provide the best care for them.